Hello and welcome back to another episode of Boombastic Health. We're out here in the wild at Health 2025 in the Diagnostic Zone, where we're the exclusive Diagnostic Zone podcast, getting to feature amazing innovations in healthcare. The next up is Michael Dalton, the CEO and founder of Ovation. Welcome to the podcast.
Thanks, Bradley.
So we love featuring founders and entrepreneurs, and typically you have to go into it thinking, hey, I'm going to make this huge impact. And then you get into it and you realize in healthcare, there are a lot of other ways that were easier to make money. And so here you are doing something that has to have a real purpose. Like what gives this purpose for you? Like, why are you doing this?
I think although whom we're serving may not always be like having that rural focus. I remember, growing up and hearing about the stories of my grandparents living in rural Wisconsin, and having to make the trek to Madison, Wisconsin for specialty care. And for me, just thinking about them in the middle of the night, being able to, have access to care, that really started me down this path of thinking about how do we keep patients. They live on a farm. How do we keep patients, no matter what's their age, connected to a health system, connected to it, and not just a health system, but a system of care. And so that was something that was really, foundational for me. And what I heard was these stories about my grandparents. I was in Ohio. I felt, we had moved away from that town, felt a little bit powerless. What can we do? How can we help? And so 30 years fast forward, that was when I was like 10. I'm almost 45 now. Fast forward, I'm actually able to make that impact and, create a company, create a care model that keeps patients connected to systems of care, especially when they need it most.
Awesome. Well, clearly rural and remote care it's somewhat of an underappreciated issue in healthcare.
Yeah.
A lot of times we're focused on how do we help people with their cancer diagnosis or things that are important, but there's this whole idea of primary care and also identifying specialty care needs that when you're out in a rural environment, that can be very tough. I had a startup once that was in teleradiology. This was back when that was a novel idea, and it was focused on serving rural and remote people who otherwise wouldn't have access to those subspecialists.
Right.
So they would go into whoever it was in town that was the one radiologist who was a generalist and have some specific issue. And like any kind of a profession, unless you're subspecialized and have this whole history of experience and training, you may miss things that otherwise should be identified. So is this care model mainly geared toward people that are out in more remote areas, or is it comprehensive? You talk
comprehensive.
Okay, so virtual care is what you're talking about. The virtual multi-specialty practice.
Yeah.
And I'd love to have you talk about that model and about, like, is that telemedicine? Is it more than telemedicine? What is this?
So when we talk about virtual care, really virtual is just the modality by which we're providing that service and providing that care. And then when we think about it, whether it's providing primary care, urgent care, behavioral health, endocrinology, rheumatology, cardiac, there's all kinds of applications that we have through a virtual modality. So this concept of being able to provide a virtual multi-specialty practice, at the core of it is what we built out is what's called a patient-centered medical home.
Okay.
And oftentimes you think about that, like from a brick and mortar perspective, but really what we want to be able to provide is a coordinated care model that starts virtually, honors oftentimes, we say virtual first, but it's not a gatekeeper model. What that's really meant is that patients who prefer to have that care provided to them virtually, we want to honor that choice, provide high quality care, and keep them connected across their care journey. They're going to need care in person at some point. That might be, it might be radiology. So they might need imaging. They might need labs. They might need a referral. But the whole point is that they're connected with a trusted primary care provider. And that primary care provider, it could be a PCP, but for many of our patients, they identify urgent care as being their PCP. And what's been phenomenal, and this is why it's universal. It's not just rural, it's rural and urban. Because even for those who live in an urban setting, they might have challenges with transportation. Being able to get away from their job, and be able to get that access to care. So we've created a care model. Typically, that patient can be seen anywhere between 7 a.m. and 7 p.m. for primary care, or from a same day or acute at 7 a.m. to 10 p.m. 7 days a week, and really honor what that patient preference and choice is, and at the same time provide kind of that continuous care journey. And we partner with health systems then, so that then we leverage some of the assets that they've already invested in, like their pharmacies or their imaging centers, to be able to provide services in one continuous network.
Okay, so the company is Ovation, and you're going into healthcare systems that are interested in some type of extension to their care model.
You got it.
Because on the surface, if I heard you say this and I thought about it from a pure provider perspective where they're building big hospitals, big brick and mortar hospitals, it sounds like what you're doing could be at odds to that. What you're explaining is it's actually complementary. Could you help me understand that?
Perfect. Yeah. So you're spot on. We recently had a health systems chief strategy officer. He talked about, hey, we just made a large investment in brick and mortar urgent cares. I'm concerned that might cannibalize. We went back and we looked at for one of our health systems, they have a comprehensive express care network, and we looked at what the volumes have been, and they've been consistent for that brick and mortar. So in essence, I look at it, we have not cannibalized. We haven't taken it away. Instead, we actually added for their urgent care volumes 20 to 25% every month. So what that meant is there are patients who they prefer virtual. They need that virtual setting, and then they can come in that, you talk about having a digital front door. I would love to be able to talk about like how we're creating a digital health home for patients, but they're coming in and then we're routing them and keeping them connected and using the assets that health systems invested in. Because there are times when they're going to need to be escalated into that express care or maybe emergency medicine into like their, an emergency room. But I would say 95% of the time, that patient is able to be supported and cared for in their home. So that's where there typically is, there really shouldn't be this thought of like from a scarcity perspective. There are more than enough, patients that are out there that need care and that prefer a way that honors what their preference is.
So this is in a way closing gaps that aren't currently being addressed. These aren't the patients that would have come in otherwise.
I think some would come in. I think the majority, though, they get discouraged. They don't take that action. They don't take that next step. And over time, that leads to more chronic disease. It's going to lead to worse care outcomes. And that's where I think it's an opportunity where we're actually saying, this is what you would like. We've heard a number of patients who've said, I have not been able to have this level of engagement with a PCP in 20, 30 years. It's largely because their job got in the way. They have busy lives from a transportation. They might have young children, and we're able to provide that care for them that says this is convenient, still high quality.
So healthcare has a herd mentality, meaning somebody has to go first.
That's right.
And nobody wants to be first. And so innovation gets stymied because the question is always, who's already doing this?
Right.
So who's already doing this?
What's unique about this, and oftentimes we get that question. So what's unique about Ovation is that, I came from the health system space, and I understood almost always when a provider would talk to me, they'd say about a third party, digital health solution. Is it integrated into Epic? Is it integrated into Epic? And because for them, they didn't want to change their workflow. So for us, what we started so I started thinking, okay, I'm going to have, really, I talk about, trust being our currency. You need to have trust with the patient. You need to have trust with the health system. You need to have trust with the providers who might be at that health system. So they understand, like, they're not thinking it's, some other EMR and that information isn't shared with them. They look at a care record and they see an Ovation visit. It's part of a continuous care journey. They have all that information. It's searchable. And so that's really what I think about is that, and what those providers had wanted, what those patients wanted is one continuous journey. They do not want to have some kind of differentiation or, so I think that
they don't want to swivel over to some other system in order to get the information.
Absolutely. So There are only 2 virtual care companies that are built on Epic. We are the only one that provides them that comprehensive practice that's built on top of it. So whether it's urgent care, primary care, behavioral health, and where we're going, and I'm going to qualify it in primary care. 50% of our patients are coming to us, and we didn't market it this way, for weight management. So they're looking for that support. They're looking, they don't want to go and subscribe to, a third party or direct to consumer company. This is something that they're looking that they have a trusted relationship with the health system. They want that to be honored. They don't want to have to go outside of it, but they want a care model that is, that speaks to them, that's unique to them, and it's personalized. That doesn't always happen.
So it's interesting because what I'm hearing there is if there's a stigma associated with what you need care for, which a lot of times weight loss is one where
Yes.
people don't want to walk right in the door and say, hey, I need help with this.
Yeah.
You provide a great option as a supplement to what the health system's already doing.
Correct.
I'm also hearing a lot of the telemedicine models I see are very primary care centered. You're saying this is primary and specialty care. It's the whole gamut that gives access. So you're equipping through Epic in the case of your core customers,
Correct.
the caregivers who are specialists to have access to patients through your unified platform.
Absolutely. And that's so Epic has what's called Care Everywhere Referral Management, and they have some other, modules and capabilities that are built in. We give our providers and the care teams at the health system, the hospital, an easy button. So our providers are literally making that referral. They're through Care Everywhere Referral Management, and it's going to an access center at the health system, and being managed as if it was a provider within MUSC or Metro Health or another health system. So it should feel seamless. It should not feel different. And that helps build that trust within the system as well. And so I think, we're seeing higher levels of adoption when we're talking, and what that means is from a referral perspective or medication adherence, patients are taking action on that because they know then how they can navigate within that respective health system. They're not having to take for the most part, not having to take, a lab or some, order set and going outside the health system to be able to do that. One thing that helps build trust as well for the health system from that specialty perspective that you're talking about from an e-consult. Are you familiar with e-consult? So, our providers are able to actually place, based on our health system customers through Epic, we are able to do an e-consult with those specialists at the respective health system. So even though we're in our own Epic, we're in our own vertical, through what we built in Epic, we can do that same level of e-consult and provide access to a specialty consult, oftentimes within hours, maybe, at most 2 days. We'll get that information back to our primary care patients.
Okay, so this could help people get diagnosed more effectively sooner versus having to wait however many weeks, months to get access to a specialist.
Absolutely.
So that's another point of value for the health system because now they're closing those care gaps and getting engaged with those patients so that they don't have some issue in the future or leak to another health system. Is that fair?
Correct. That's what I think one of our biggest values is what I call keepage. We want to keep those patients within the health system in that framework. And there's oftentimes, great, we'll do an e-consult, and then we're able to say, no, we need you to get scheduled with dermatology. Our urgent care providers, they love that ability with that e-consult. They're some of the biggest utilizers of a derm e-consult to get that, provide that, within hours and access to a dermatologist. That's almost unheard of.
Right. Well, the company is Ovation. We got Michael Dalton, CEO and founder. It sounds like you have a really innovative model that is helping to fix a lot of the things that are broken with healthcare. In this case, what I hear is really access and empowering the healthcare system to provide ubiquitous access for patients that also complements the existing infrastructure that the health systems have. So I commend what you're doing and the progress you've made. Thanks so much for being here.
Thank you, Bradley.
So thanks for, we'll do this handshake. That's a good photo op right there.
Yeah, thank you.
Someday when you're on an island, you should invite me and I'll bring that.
I will do that.
Perfect. Awesome. Hey, thank you for being here for another episode of the Boom Bostic Health Podcast here at Health 2025. We'll see you next time.